a demonstration of the specialty templates area of prognosis. This area is used to document and store information from the patient's record. This information is typically anything that is outside of a standard SOAP note. This information can generate its own documents within the patient's document list, and it can also be included in the progress note for a particular visit. Many examples of these items are available in our library, and a few examples are here for you to see today. This is our chronic care management template, where you can utilize to document a chronic care management plan. We also have documents for other chronic diseases such as diabetes care. We have assessments for items such as geriatric patients, nutrition assessments. You can also have this information populate into a patient form that can be completed on ProCheck-in or on the patient portal. When that information is populated into the system, it will come directly into this area. One of the examples of a popular patient form is the PHQ-9 Depression Screening Questionnaire, which can come in with the score already scored for you within that template. Each of these documents, as I mentioned, can have an output format, and you can determine what you want this format to look like. Once this information is completed by the patient and accepted into the patient's encounter, it will document this in the patient's document list. We also have information in this area for workers' compensation and injury care. There are templates for testing for occupational medicine and employer health. You can also utilize this area to document patient satisfaction surveys, which can again be documented in the patient portal as well as ProCheck-in. And the most common documentation in this area are procedural templates or surgical templates. The positive about these templates is they're super flexible. So when you preview the patient's output, you will see the narrative surgical note, and all of the CPT codes and ICD codes associated with this template, or any of these other templates for that matter, can be directly embedded into the encounter, automating your charge capture. And here's another example. Another thing that we can do is also embed the J codes for your injectates directly into the encounter. So when you document this information, it pulls your J codes, which can also pull any associated NDC codes directly into the claim. So when this encounter is finished, the provider has done their documentation, there are records of each item within the patient's document list, and all of your CPT codes and ICD codes are captured in the encounter and then also flow into the claim.